You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that had, has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoy the podcast, please listen, subscribe, like, and share it with friends. Thank you. Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcasts, and I have Anthony B. Miller. We're going to be discussing the impact of nutrition, radiation, both ionizing and electrical and magnetic fields on cancer, and also your job as well. So, Anthony, thank you for coming.
Thank you for having me.
Yeah, tell me what's a little bit about your background. How did you decide to work on the factors that may affect cancer?
Well, I qualified as a physician in the UK in 1955. I did my normal house jobs and work in hospital. And then I went to the British Medical Research Council, did research mainly on tuberculosis, but also research on the treatment of lung cancer. And I began to realize that treatment of diseases like lung cancer was really very inefficient. And what we had to do was to prevent the disease occurring. And I discovered there was a position in Canada open for somebody like me. I applied, was accepted, and I set up the epidemiology unit of the National Cancer Institute of Canada, which I directed for 15 years. And I recruited a number of staff to work with me on statistics, on nutrition, and interviewing patients and normal people. And we did studies on diet and cancer, on occupational cancer, including radiation, and on occupation and cancer. And then later, I was invited by the head of Ontario Hydro, the Crown Corporation in Ontario, responsible for generating and transmitting electricity, to do a study of their workforce. And we discovered that the workforce who went in and out of particularly electrical fields in the course of their work, had increased risk of leukemia and lymphoma, another form of blood cancer, and also probably brain tumor. And I also did a study of childhood leukemia in Toronto, in which we were able to measure electric and magnetic fields in the home. And we found that when the home was wired with the conductors kept separate, there was quite a bit of electrical and magnetic fields, particularly magnetic fields, released. And we found this was associated with increased risk of childhood leukemia. We have known for some time. Sorry, I was going to say we have known for some time that radiation in the form of X-rays of the pelvis of women during pregnancy increases the risk of leukemia in the child. So we knew in that respect that radiation was hazardous. And the studies we did of uranium miners and, of course, the studies that were done of the survivors of the atomic bomb explosions in Hiroshima and Nagasaki confirmed increased risk of cancer, which in fact increased during the lifetime of the individuals. We also have considered the potential hazards of radiofrequency radiation released by cell phones and towers, and particularly this new proposed 5G. And we're very concerned that this will increase the risk of cancer. Cell phones held close to the head increase the risk of brain tumor. And it's also clear that this sort of radiation can cause adverse effects on childhood development and also in terms of fertility in both men and women. In terms of nutrition, yes.
Question here. There's a lot to talk about. If you don't mind, maybe we can start out with radiation, both ionizing, electromagnetic. So I think it's much more easily accepted that ionizing radiation, from nuclear sources, from CT scans, MRIs, etc., can pretty directly lead to cancer if the exposure is high enough. But I think something that's a lot more hidden or just not recognized is, what is the radiation from all the electronics we're surrounded by, like you said, 5G, by cell phones, by, AirPods, by all this stuff that we use, computers constantly. That seems to be a lot less talked about. And for some reason, there's a lot more resistance, it seems like, in the scientific community to accepting that those can cause, dysfunction in the body. What's your thought there? Do you see that that's the case, or is there a pretty ready acceptance that our devices could be affecting us negatively?
Well, I think there's increasing recognition that they can. I and my colleagues have just had a paper published in the journal Frontiers of Public Health, in which we've reviewed the evidence that radiofrequency radiation increases the risk of cancer. Epidemiology studies, particularly in Sweden and France, have shown the association of prolonged cell phone use with brain tumors. And more recently, there have been two major animal carcinogenicity studies, one conducted by the National Toxicology Program in the United States, a $20 million study, and another conducted by the Ramazzini Institute in Italy, which is generally regarded as prestigious. And both of them found that prolonged exposure to rats will increase the sorts of cancers that we are seeing in humans in relation to the use of radiofrequency radiation. So I and my colleagues now consider that radiofrequency radiation must be regarded as a class 1 human carcinogen. And that being so, a lot of things would have to change. In Canada, the so-called Safety Code 6 is not sufficient in preventing people getting exposed and getting cancer as a result of this exposure to radiofrequency radiation. So I think certainly in my view and that of my colleagues I work with, the evidence has become extremely strong that this is hazardous.
So what does that mean? Does that mean that manufacturers, for instance, of cell phones need to change the shielding of their phones when used by people? Or does that mean that, where would how would you affect, I don't know if you could affect the behavior of how people use, for instance, cell phones and computers, but the devices themselves, it sounds like that's where the change would need to be.
Well, there needs to be changes in the way people use cell phones. It's really particularly hazardous to use them right up against the head. They should be taken away from the head. And all these sorts of exposures, the further you are away from the source, the less the risk to you. And using wired connections to telephones is far safer and doesn't involve exposure to radiofrequency radiation. But if you have to use cell phones, then you should preferably use not the sort of earbuds that Apple have recently released, but special connectors which essentially use air as the conducting mechanism of sound to the ear, and this reduces your exposure substantially.
So if I were to compare AirPods, the wireless Bluetooth headphones, in terms of radiation exposure, well, if I were to compare these four things, putting a phone to my head and just speaking into it versus using the AirPods, the Bluetooth wireless headphones, versus using wired headphones, versus using air gap headphones, with a little plastic spacer, would that
air gap is good, but you probably should have tried to avoid Bluetooth because that involves the same exposure. And there are some special, which are produced especially by somebody in Israel, safe buds, which do reduce exposure substantially. But as far as possible, people should use landlines, cut down their use of cell phones. If they have to use them, keep them away from the head. If they can get these air-filled connectors, that would be even better.
Has there been any impetus by cell phone designers to modify the design of their phones? Is that even possible to reduce the radiation effects?
I haven't seen any evidence of that. As far as I can see, neither Samsung nor Apple have recognized this as a potential hazard. But increasingly people are recognizing this. One of the things which doesn't relate to cancer but relates to people's health is that increasingly it's recognized a number of people are actually sensitive to this form of radiation, non-ionizing radiation, and become quite sick if they're exposed to it. The exposure could either be phones or cell towers or smart meters. For smart meters, you should, as far as possible, introduce shielding to protect yourself from the effects.
Why does this cause effects in life? Why does it affect animals and people? I haven't heard that talked about very much. Like, is it interfering with cell-to-cell communication? I mean, what do you think is the mechanism by which these EMF fields are affecting people?
Well, I'm not the sort of person to talk to about mechanisms. Dr. Martin Powell has done a lot of work on this. I think you should talk to him. He's found changes in oxidation, the way cells deal with their normal metabolism, which appears to be responsible for the ill effects that we're seeing.
So what is your role? Is it, it's calling attention to these problems, but specifically because of your training, your long history, your influence, what is your role? How do you want to affect change?
My role is, I think, to do my best to point out to people what the issues are. I've communicated several times with ofCanada. They've so far ignored me. I've communicated with the Minister of Health. As I said just now, I've recently, with my colleagues, published a paper on this, which we're hoping will get wide distribution. Whenever I'm asked to talk on this, I agree as far as I'm able. There are symposia in Montreal and Kingston in Ontario I'll be presenting to in September on this issue. Experienced epidemiologist, I've done a lot of studies. I can assess studies, and I think my contribution should be to point out the problems to the general public as far as I'm able to reach them.
So let's talk a little bit about 5G. How is that going to be different from our current networks, and what do you guess is going to be the effect on living creatures and people if it gets implemented?
5G, which means fifth generation, also incorporates other forms of radio frequency generation emitting, 2G, 3G, 4G. But the particular radiation in 5G is rather superficial. It's into the skin. It's been evaluated by the US military for crowd control. It's already been demonstrated to cause problems with plants and insects. And as it's being introduced, because it doesn't travel very far, it's being introduced on small towers which are attached to telephone towers and whatever in people's neighborhood. And this is going to bring exposure to them. And it wouldn't surprise me if once this happens, there'll be so much illness that the firms will have to withdraw it. The option, preferable option to this is to get internet connectivity through fiber optic cables, because these are much faster. They do not involve exposing people to radio frequency radiation. I'm fortunate in that I live in an area where Bell Canada is providing television and internet and telephone services to my home by optical fiber. So the risks in my family are much less.
So the state of affairs is what? That 5G is coming. There's no push to stop it, and it's going to be here no matter what.
Well, there are a number of organizations which are developing in a number of areas to try and point out to people, the authorities, that this is a bad thing and to oppose the introduction of 5G. My own feeling is that these will sometimes work, but when they don't, what will inevitably work will be the lawsuits that will follow the introduction of 5G when people get ill and sue the firms that have introduced this into their neighborhood. And one of the things we know is that the major insurance companies, Lloyd's in England, Aviva in North America, will not insure companies against this sort of potential risk. So that firms have got to be careful.
If firms, seem to just be charging ahead, which is what it seems like to me. Again, I'm not an industry insider, but it seems like they're just charging ahead. Perhaps an intervention can be made at the insurance company level, where you speak to insurance companies, show them studies, et cetera, and tell them, hey, let carriers know we're not going to insure you and that we consider it too risky. Maybe that'll put a pause on their plans to put in 5G. I don't know.
Well, they've already done that.
Okay.
And those firms that have chosen to go ahead have presumably made some sort of calculation that they will earn much more and can take on the risk themselves. I think they are very unwise, but there's not much I can do about that. If people are prepared to act stupidly, they will.
Well, as a regular person living in a neighborhood, is there anything you can do to mitigate your exposure? I mean, I'm sure you could probably control the environment in your home far more than you could outside your home, and that's actually a public space. So, I mean, any recommendations for someone listening on what they can do?
I think what they should be doing is to try and influence their local their local council to act to prevent the introduction of this. Now, this sort of action by people has, I understand, been made illegal in the United States, but that hasn't prevented a number of organizations to try to do their best to prevent the introduction of 5G.
Well, switching a bit to the nutrition side of things and how nutrition affects cancer. Again, I've only heard of random genetic mutation, and we're going to give you more medicine and chemo and radiation and surgery to stop your cancer, which is what the science has been saying for 50 years. It's rare. I mean, I've heard from some people, which is good, but it's rare that I've heard anyone talk about diet even being a factor in any condition.
That's
cancer.
surprising.
So what's your what's the background here?
Well, the American Institute of Cancer Research, the World Cancer Research Fund, have been very active in trying to promote healthy diets to prevent cancer. this has been going on for more than 20 years. My group was one of the first to do studies on diet and cancer. We found increased risk for colon cancer with red meat consumption. We've known for some time that stomach cancer risk can be reduced by a diet which is high in vitamin C. Increasingly, it's recognized that red meat consumption should be reduced to as much as possible, and that what people should do is to substitute with fish and preferably plant-based diets, which is something that we first started advocating more than 20 years ago. The other thing that reduces risk of cancer associated with nutrition in a way is exercise. Exercise substantially reduces the risk of breast cancer, for example, and will reduce the effect of other cancers. So healthier nutrition, much less red meat, very little preserved meat, avoiding nitrate preserved meat, fish, plant-based diets, these will reduce everybody's risk of a number of cancers.
What about if someone has been told that they have cancer? Can they make changes in their diet to affect their outcomes? What's your belief there? What does evidence show? Is there evidence?
There is some evidence, yes. We've done studies, particularly on breast cancer, to show that the diet post-diagnosis, during and after treatment, it should be as healthy as possible, because that will help to reduce recurrence or progression of cancer. So that it's not just the prevention cancer occurring, it's also after, if cancer has occurred, that one should do one's best to consume a healthy diet. And people, by and large, know what a healthy diet is. We've been taught for years that we shouldn't have too much meat, particularly red meat, more plants, plant-based diet, and vitamin C and other vitamins preferably in food. Additives, by and large, are not needed if you eat healthily.
How about injuries? Red meat bad for you. Well, what if you consume a plant-based diet, but the plants you're eating, have plenty of pesticides in them and everything, but the meat you're eating is, let's say, grass-fed and pasture-raised, and it doesn't have the hormones and antibiotics that maybe traditional meat would have? Would you say then that perhaps it would be okay to eat meat, or are you saying wholesale red meat bad no matter what?
I would say it's a bad thing to eat red meat. In terms of pesticides in plants, of course, we should try and encourage farmers to reduce as much as possible. But the pesticides don't get into plants, they're on the surface of the plants. So one has to wash them thoroughly, boil when you can, and that will largely reduce ill effects of pesticides.
Any thoughts on sugar?
Sugar?
In terms of
if you take too much sugar, you'll tend to put on weight. So you should cut down the amount of sugar in your diet. And if you insist on having sweet things, have plant-based sweet things. Fructose, which is the sugar in plants, is much healthier than sucrose, which is what we generally have if we add sugar to tea or coffee. Avoid that. Get used to not having sugar in your tea or coffee. Cut down the amount of sugar you add to various meals.
All right. In terms of diet, have you seen any dietary interventions, whether they're, if you want to characterize them as extreme or not extreme, but that have affected cancer in a big way, affected people that have cancer in order for them to, delay other therapies or to, maybe go into remission? Have you seen any evidence of diets that can really affect cancer in a big way?
Well, we believe it will, but I agree the evidence is not that strong, and I personally have not done studies of that type.
Have you seen any studies that are attempting to control for diet, regardless of whether they're studying cancer or not? I mean, I've seen, it doesn't seem like there's, when I've spoken to researchers and they talk about clinical trials and things like that, they all seem to say like, oh, it's not possible to control for diet. Have you seen that anyone is doing such a thing, or is it not really?
Well, I agree it is rather difficult to control for diet, but the sort of experimental evidence you're suggesting we need is really not available. It's just that the associations we've noted between when people eat poor dietary patterns and the occurrence of cancer, which have led us to promote a healthier diet as a means of preventing cancer. I mean, there are studies going on in the UK, in Canada, in the US, about people who've taken healthier diets. They're being followed, and the evidence is increasing all the time that healthier diets reduce the risk of cancer.
So what do you think is ahead for the near future, and maybe the further future? What big sea changes do you see coming, if any?
Well, I anticipate that as we learn more about cancer and individuals' susceptibility, we will be able to be more specific in our advice to individuals. At the moment, the work on genetics and epigenetics largely relates to treatment, but I foresee this as the evidence gradually accumulates, that people will soon be in a position to have genetic tests which will tell them whether they're particularly susceptible to certain forms of cancer, and then can be given prescriptions to try and avoid it, including healthier diet, I anticipate, and more exercise.
Okay, but do you see any big changes coming? Personalized medicine, the promise of that.
Well,
genetic engineering,
personalized medicine at the moment relates to treatment, but I think this will shift. And as people discover the limitations, they're bound to be limitations of so-called personalized medicine in terms of treatment. I think increasingly the geneticists will shift to seeing how they can identify individual susceptibility and introduce measures to reduce individual risk.
Okay. Well, very good. What's the best way for people to see what you're doing, what you're working on, and maybe get in contact?
Get in touch with me, you say?
If you wish it, yeah, or at least to see your papers, your work. I mean, you prefer to be contacted through your website? Do you prefer not to be contacted at all, or through social media? What are you comfortable with in terms of people that want to follow up and find out more?
I'm comfortable with people contacting me. If anyone who listens to this podcast wants to send me an email, I'd be happy to receive that. My email address is ab.miller@simpatico, sympatico.ca, or ab.miller@utoronto.ca, which is simpler. And I'll respond to both because they both come to my computer here.
Okay, excellent. Well, Anthony, thank you so much for coming on the podcast today. I really appreciate it.
Thank you very much for giving me the opportunity.
You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and share it with friends. Thank you.